All right, there's my cue. Recording is in progress. So everyone, welcome to this session's topic for RSI Day. My name is Andrew Dolhe, and I'm your host today. I work as an ergonomist at the Occupational Health Center, and we have been using this time period as a special sort of sessions that we don't normally do since I think it's 2003. Pre-pandemic, we were very hands-on out in the community. Some of you may have remembered some of our displays where we actually did hands-on ergonomics, and we've had different panels and great information that we've done. This year, we still kind of made it virtual, and we've had 3 sessions. Last week, we had one on meditation in a sense of helping those with chronic pain as it links to MSI on the occupational side. And there's some reviews and some other information that will be on our website shortly. Today, we have another topic on the safety culture from our friends at Safe Work Manitoba, and I'll introduce them in a second. And then tomorrow, myself and occupational health nurse here, Jeffrey Thompson, will be doing ergonomic assessment tools, 2 of them, both a little bit on the physical side and the psychosocial side. So very interesting for those that have that. Please register if you haven't already. All right, so let us go to the next slide and do what we have been doing for a while now, is our land acknowledgement. And I don't want to just make it, just don't want to make it something memorized and such, but I'll there's a lot that has been put out there recently on we've been doing it for a while, and different ways and such like that. So I encourage everyone to do some reading on their own about different places and organizations and how they do it and things like that. So for us here at the Occupational Health Center, we'd like to first acknowledge that we are presenting this webinar on Treaty 1 territory where the Occupational Health Center is located. The traditional territory of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, as well as the homeland of the Métis Nation. We do respect the treaties that were made on these territories, and we encourage that we acknowledge that we are all treaty people. At the OHC, we commit ourselves to the process of reconciliation with Indigenous communities through the work that we do, and as I just mentioned, reading about the treaties, reading about the Truth and Reconciliation Committee calls to action, and more. All right, so there we go. Next slide, please. As far as the webinar is concerned, this is a webinar format, so our panelists can't see you. So please communicate through our chat box. We do have some moderators that will take the chat questions and put them into a Google Doc. So when our presenters are finished speaking, we'll have time to go through the questions at that point. And as I said earlier, this is recorded, so it will be put on our website later. All right, and off we go. So let's talk just a quick second about the OHC for those that are not too familiar with the work that we do and who we are. So the official name is the MFL Occupational Health Center. We've been around for 40 years, providing health and safety education, capacity building, and knowledge to workplaces throughout Manitoba. We are funded by the Winnipeg Regional Health Authority, so we're healthcare. And recently we moved from our location down on Broadway to 167 Sherbrooke. And we're in a building with a clinic, which is primary care. We're also primary care, but we're on the occupational side of it. And CERC is also with us too. So if you would like to come and do some research or ask one of our resource people for specific information on a topic that you're struggling to find deep resources on or information, both our research capabilities and the books that we have are there for your disposal. We do have occupational physicians that will see workers with all kinds of what they believe is to be work-related injuries, diseases, disorders. So more information on that if you'd like to contact us and how that works. And then, of course, our website, which has plenty of resources. from resource sheets, one-page information bulletins that are on different health and safety topics and translated to different languages, to all the other programs and services that we offer. So it's way too much to go through in our seminar. So come and call us and get more information for those that are more interested in what we do. All right, so now we're going to flip it over to the presentation that Safe Work has. And I'd like to say thank you, first of all, to those that have partnered with us over the years. Safe Work has been a partner both in the promotion and the one I talked about where we had hands-on ergonomics. We had 9 different tables and 9 different people, leaders leading the activities. So we counted on Safe Work and their group of MSI specialists to help with that, and other safety specialists. So thanks for that partnership. And then this year, it's a little bit easier on you. You get just to talk for an hour and a half and don't have to do much else. But we'll look forward to that. So we have 4 speakers with us today talking on safety culture, a fundamental component in musculoskeletal injury prevention and psychological health and safety. So 2 topics that, again, as far as requests for information at the OHC, we're getting a lot of. And this is something on that note, again, if you're kind of new to this webinar, or to the Occupational Health Center, we've done this topic for about 3 years in a row now. So if you go to our website, you can click on our YouTube channel and you can find the guest speakers that we had from the Institute of Work and Health in Toronto, and a professor from Montreal and university. And in the year before, we had all these different little tidbits leading up to wrapping our head around psychological health and safety, and as it links to MSI. So I'm very happy here to have Gail and Michelle and Mike and Jen, who are going to do their little pieces on this topic. All right, so that's it for me. We'll see you again at the end of the topic, and we'll open up for questions at that point. So I'll turn it over now to our first speaker, Mike.
Okay, thank you so much, Andrew. And welcome everybody to the presentation. So just before we get started, we do have a bit of a disclaimer here. So this presentation is not a substitute for legal or health advice, and it should not be relied on as such. Viewers should seek their own legal and health advice and or follow workplace procedures. Next slide. So what we're going to cover today is workplace culture, as Andrew mentioned, and how it ties into psychological health and safety and musculoskeletal injury prevention. We're also going to talk about who benefits when you have a strong culture, and that's at the individual level and at the organizational level. Next slide. Okay. So when it comes to safety culture, it wasn't until recently that we had a definition. Before that, a definition didn't really exist. So Safe Work Manitoba teamed up with the Institute of Work and Health and came up with this definition. So what safety culture is we always focus on a positive safety culture, and I'll use positive and strong interchangeably throughout this presentation. But a positive safety culture exists when a set of shared values and beliefs, and we'll define those in the next slide, about workplace safety and health influences and drives practices for preventing workplace injuries and illness. So this definition really stresses the interaction between beliefs and values and practices, and beliefs and values drive practices, and practices in turn illustrate and reinforce those beliefs and values. And a good way to think about it when you look at safety culture is it's the personality of the workplace from a safety perspective. Next slide. So we're going to define what values and beliefs are as it relates to safety culture. So when we look at values, these are what we consider important. So people value and expect safety and health in the workplace. People in the workplace are our most valuable resource. They're not just a number. And safety and health is valued equally with productivity, quality, and pay. When we look at beliefs, these are how we achieve our values. And this includes workplace injuries and illnesses can be prevented, so they're not inevitable. Leaders drive improvement, and this is key. And when we talk about leaders, we're talking about your executive leadership. So CEOs, VPs, they need to walk the walk and talk the talk when it comes to safety and health. If your leaders aren't committed to safety and health, your workers are not going to follow those safe work procedures or the training that's been provided. So it all starts from the top, and leaders need to drive that improvement. We all play a part in building health and safe workplaces. So it's not just a safety coordinator, it's not just a safety and health committee or the supervisor, it's everybody in the workplace. So for example, here in Manitoba, we're currently in the winter months. If you had an overnight snowfall and you're the first person to come into your workplace and you notice that the steps entering your workplace are slick and you don't report that hazard, that's an indicator of a negative safety culture. If you were invested in a safety and health program, you as the individual would be reporting that hazard, and your company would be dealing with that hazard to prevent your coworkers from coming in and slipping on that ice. So that's what we're talking about when we're talking about safety cultures. Everybody's invested in the safety and health program. So when we look at safety culture, we provided the definition, but it's really an umbrella term, and it focuses on, or it depends on two factors. It depends on workplace culture and community culture. And what do I mean by community culture? Well, the community sets out the expectations for safety and health, and it sets the standard workplaces are expected to meet. And we can see that from a psychological health and safety perspective. It wasn't up until recently when we were talking about psychological health and safety in the workplace. In the community, you saw a lot of mental health campaigns out there, that awareness building. And now we have, in Canada, we have a standard for psychological health and safety that workplaces can now implement. So that community drives or sets that expectation, and workplaces are expected to meet that expectation. So next we have the indicators of a strong workplace culture. These are also known as the 6 dimensions, and these allow us to measure the values and beliefs that I talked about previously. If we just focused on those values and beliefs, it's difficult to see or measure those in a workplace, but these dimensions allow us to measure those. So first, we have safety and health hazards and concerns are addressed. So basically what this means is if you have a worker who reports a hazard to their supervisor, that supervisor is taking action. An indicator of a negative safety culture would be a worker reporting that hazard and then nothing being done about it. Next, you have leaders demonstrate a commitment to safety and health. So as I mentioned before, it starts at the top when you're trying to change your culture at your workplace. If your leadership is not committed to the safety and health program, you're not going to change your culture. And workers, again, if you have on a manufacturing floor, if you have a leader that comes in and doesn't wear the appropriate PPE that's required on that floor and workers see that, it's just going to send the wrong message and they're not going to be invested in your safety and health program. Then you have trust and respect saturate the work environment. So there's the trust and respect between worker and supervisor. Workers feel comfortable bringing or reporting hazards to their supervisor or bringing any concerns from a health and safety perspective forward. Then you also have each person in the organization is personally invested and accountable for safety and health. And this is key when it comes to safety culture. So everybody's on board with the safety and health program. They're going to correct any, if they see their coworkers doing something unsafe, they're going to have that conversation with their coworker. If they see a hazard, they're going to address it. And if the employer is providing controls to protect individuals from a certain hazard, they're going to be invested in where, if it's PPE, they're going to wear those, the personal protective equipment accordingly. And then you also have the work environment is inclusive regardless of role or background. So again, everybody's involved and participating in the safety and health program, and diversity is looked at as an asset and is welcomed. And then you also have continuous learning as a feature of the organization. So the employer provides training, health and safety training to their workers and allows them to take professional development when it comes to safety and health. So to bring this into perspective for today's presentation, a strong culture helps to ensure your psychological health and safety and musculoskeletal prevention efforts are effective in reducing injuries. If your employees are not personally invested in safety and health, they're not going to engage in psychological health and safety or MSI prevention. So, and this could lead to increased injuries. So the safety and health program is super important, but safety culture is the other side of the coin. You need your workers to be invested in the safety and health program in order for them to actually follow that program and follow those safe work procedures that you put forward. So now I'll pass it on to Jen, who will look at the importance of strong culture and how it is related or intertwines with from the psychosocial perspective.
Thanks, Mike. And thanks again for having us here today. So just to kind of build on what Mike has been saying, really to build out our programs and get engagement from employees to create safe and healthy environments, we really do need culture. It's really hard to implement a psychological health and safety program without culture. So if employees don't have trust, or safety and health is not a priority, you may not see that change in other aspects of your workplace. So if we look at culture from a psychosocial perspective, today our focus is going to be on building workplace culture, and the CSA standard, what you see on your screen, can really help us to get there. And so the standard, just to give a bit of background, as it's often referred to as, the standard. So it's really a guide. It's a guide or roadmap to really building that system of psychological health and safety in the workplace. And what's really important to note is that building a psychological health and safety management system is something workplaces will do over several years. It's in essence really a culture change, a shift in making sure that psychological health and safety is incorporated into everything that your workplace does. So whether it's a policy or a program, an activity, it's really building that awareness, and then that change is going to be how business is done. So it's really just that really strong culture shift in your workplace. It's also important to note that when we talk about psychological health and safety management systems, this really does include your bullying, your violence prevention, your harassment-free policies. It's setting that culture of where one worker, every worker, feels physically and psychologically safe in their work environments. And I think it's really important to understand and hear that a strong safety culture means that we're respectful of one another, that safety and health saturate our workplaces, that we're all invested. And we heard these in the dimensions that Mike just talked about. And because of all of these really important indicators, they help us to see that we all need to work together to make health and safety, simply put, how we do business. So my part of the session here today is really talking about psychological health and safety and how that fits within culture, and how psychological health and safety can really be added to your MSI program, and how it can be kind of seen as together. So when you look on your screen here, just the quick definition of psychological health and safety from the CSA standard. So while our health is primarily our own responsibility, the workplace can and does play a significant role in our ability to manage both our physical health and our psychological health. So the workplace can play a role in helping or hindering our psychological well-being. So when I first read this, I kind of first thought, yes, the workplace does play a role in our overall psychological health and safety. When we don't feel psychologically healthy and safe at work, we likely see that decrease in morale, maybe more absenteeism or presenteeism, so being at work but not accomplishing what you need to do, decreased productivity, and the list kind of goes on from there. But if we kind of thought about that in terms of what if psychological health and safety was embedded in our culture of the organization, do you think, just kind of thinking to yourself, do you think that would change something? So if I feel safe to speak something on my mind, or if I'm respected, if people are included in a decision, the very culture of that workplace begins to change, and you'll see a change in your own workforce. So the CSA standard helps to provide that framework. And if we turn to the Mental Health Commission of Canada, they also see that psychological health and safety is about making sure that we're not only building it into the culture, but creating these spaces, these psychologically healthy and safe spaces that really promote that positive culture, that promote that staff well-being. It works to prevent stigma and discrimination. So it builds that into the workplace culture. It helps us to contribute to that positive and productive working environment, so where everyone feels safe psychologically and physically at work. So as we talk about culture and the overlap with psychological health and safety, we see that we need to have a positive culture to be able to impact psychological health and safety in our workplace. And this can directly impact our mental health. So when a lot of us have seen some of these stats. So we know that 1 in 5 Canadians will experience a mental health concern in their lifetime. So that's 20% of Canadians. If you think about your workplace, that's a significant number of folks who could experience a mental health concern. And let's add some context to that. So if you look at the actual definition of mental health, you can see it on your screen. You can see it's a state of well-being in which the individual realizes his or her own abilities. They can cope with the normal stressors of life, can work productively, fruitfully, and make a contribution to his or her community. And I'd like to add this in because I think it's important that we know that our psychological health and safety in our workplaces can directly impact our mental health. And what's important to mention here is that we all have mental health. We all have days where we may be struggling. We all have days where we may not be ourselves, and we're not alone in this. But what I really want to make clear is that on those days where we may be struggling, our workplace can help to contribute to someone feeling safe enough to say, I need help, or I'm not myself today. That simple act of either saying this or noticing when someone is struggling is really embedding psychological health and safety into our culture. So if you think to yourself for a minute, have you ever been in a situation where you might be struggling, or at home or at work or both? And someone simply asked you if you're okay. So these are powerful words that when you're in kind of not in a great place, can help to support you and make you feel psychologically healthy and safe. It's becoming the very cloth of your organization. When someone asks you with genuine intent from a place of concern, that's culture. So let's take a look at the psychosocial factors. So the psychosocial factors are within the CSA standard. And these are factors that can impact our workplaces psychologically, but also could have an impact on our MSIs. And the CSA standard talks about the 13 factors, which can quickly become hazards in a workplace if they're not addressed. And you can see them on the screen. So I won't go through them all, but I picked out a couple here, and I know Gail's going to go through a case study at the end, which is going to go a little bit further into these. So let's take one: clear leadership and expectations. So when we talk about this in the context of psychological health and safety, we see that when our leaders give us accurate details on what they would like to have done, when leaders communicate what success is, it shows employees the way forward. Let's look at clear leadership in the context of an MSI. So if we looked at an MSI, when a leader suggests that we need to get 100 widgets on this truck today, let's be safe, let's do this together, let's use proper body mechanics, let's take a break when you need, and use equipment that's been provided to you. This is also clear leadership and expectations, because employees know what is expected of them. But imagine if you turned that around and a leader said, get to work, you've got 1 hour to load these widgets on the truck. Which scenario do you think is more psychologically healthy and safe, with less opportunity for a physical injury, an MSI, a psychological health concern? So the overlap of psychological health and safety can't be stressed enough. If our focus is off because we're thinking of an issue at home or at work, this is psychological health and safety. But if we're doing that and we're thinking of something else while we're walking to work and we don't see this ice and slip and fall, that's where our focus is off, and then we can sustain some sort of injury from doing that. So we could look at all of these factors in kind of those same terms. But as I said, Gail is going to be doing a case study in the coming slides here. So if we create a culture where we look at all of these aspects of our job and how they interplay, like I said, it really does become the cloth of our organization. So when we look at if we can embed this into how we do business, one idea is to really think about aligning our programs with our overall goals of our workplaces. If we know that we want to reduce injuries, which includes MSIs, what is our workplace doing already that might support these changes? And we know that we should try to get supervisors to communicate in an effective way, to have leaders lead by example, that's culture, to use the equipment in the most effective way, to strengthen our leadership skills where we know how to talk to workers in a psychologically healthy and safe way, and to really recognize and self-reflect on ways we can motivate more positively. So to encourage workers to take a break when they may need to reset. If we do this, this is really setting up culture where we speak and do this in a more psychologically healthy and safe manner. when we can impact the work of workers. So I recently read a short web blast that talked about the impact of including workers in getting commitment rather than demanding compliance. And you might see that by adopting this culture of, having commitment and inclusiveness of, having people included in the decision making, you'll get workers maybe to use the equipment that's needed to lift, or to be more mindful, or to be treated more respectfully. So something really to think about. I'm going to turn over to Michelle, and she's going to introduce us to MSIs. Thank you.
Thank you, Jen. Okay, so we can go to the next slide. So we often think of ergonomics as proper working heights, properly configured computer workstations, and manageable safe lifting loads. But in fact, ergonomics includes all human factors, to include the psychosocial response to work, the cognitive demands of work, and the overlay of habit and attitudes. What Jen introduced to us is the emotional and cognitive benefits to a healthy workplace culture where psychological harm is minimized. It really is all-encompassing, and I'm excited that we're coming to a position of recognizing the interconnectedness of all things human. The safety world is beginning to appreciate this side of work life. In fact, the goal of NIOSH for this decade is to create work environments where workers not only go home safely at the end of the day, but sometimes in an even better and improved psychological state than that of which when they arrived. I would like to talk about how the culture of an organization can create an environment where workers are better positioned to prevent MSIs. A worker's psychological response to workplace culture can affect the body and performance behavior in negative or positive ways. First, we're going to define what musculoskeletal injuries, or MSIs, are. And then we're going to look at the way ergonomics and psychological health can work together to create a positive work culture. Next slide. Our bodies are constructed of hard tissues called bones. The body is also constructed of soft tissues, and they include muscles, tendons, ligaments, discs of the back, nerves, blood vessels, and joints. The bones provide structure for our bodies, while the soft tissues connect the bones and allow for movement. We call this the musculoskeletal system. When we grip, lift, carry, pull, or otherwise handle or move materials, we impose demands on these soft tissues. These soft tissues have limits for how much they can be compressed, twisted, or pulled before they'll begin to break down. A musculoskeletal injury, or MSI for short, is soft tissue damage or aggravation in the musculoskeletal system caused when demands exceed the tolerance of connective tissue or related soft tissues. Damage can happen suddenly from a single event, or quite commonly, they develop over time. When either event occurs, we call it an MSI. Next slide, please. So, what can contribute to an MSI? Outlined in the Manitoba Workplace Safety and Health Act and Regs are 6 factors that are recognized as the primary contributors to soft tissue injury. They're described as the definition of an MSI and include forceful exertion, awkward and sustained postures, repetitive motions, vibration, mechanical compressions, and limitations on motion. The legislation also refers to other factors. These are not listed in the legislation, but we can identify these through experience and from other jurisdictions. These are all factors that can increase the impact of those primary 6 hazards when done poorly, and can reduce the impact of the original risk factors when done well. You will notice that psychosocial factors are listed as having a negative or positive impact on the musculoskeletal risk of injury. In the next few slides, Gail is going to talk about the interaction between psychological health and MSI safety, and how culture impacts both, and how both impact culture. Gail's discussion will be highlighted in the form of a case study on the next slide.
Thanks so much, Michelle. Hi there. I would like to introduce you to Janine. So here we have Janine. She works in a warehouse where stock items come in and out daily, and they need to be moved and managed in a timely fashion. The work is heavy and can be relentless depending on the deliveries that day and how many people show up for work. Janine's manager is a bit gruff and seems to be under a lot of stress. He doesn't say hello in the morning, just walks by everyone with his head down. When he gives out assignments, Janine feels that she's singled out for the real grunt jobs. She gets the impression that her boss doesn't feel that women should be in this type of job, so making a point. It's like he wants her to fail. No one talks to one another, so she's reluctant to ask for help. She sees where improvements can be made, but she is unsure how to bring her suggestions forward. Janine is exhausted by the end of the day. She is often under pressure to get her orders completed in time. She feels that it is her fault and that she is inadequate, so she will work through her breaks to get the job done. She also has a nagging low back pain, especially on the right side. It may be from all the bending into the back of the racking to load or unload boxes and crates. On some days, it's so bad that she pops painkillers to the point where she feels fuzzy, but pain-free. All in all, Janine feels trapped and sore and exhausted. She feels physically tense and wound up while at work. She doesn't want to talk to her coworkers. She just wants to put in her time and get out of there as soon as she can. And when she gets home, all she has the energy to do is plop herself down on the couch and spend her time watching TV to get her mind off everything else. So let's take a closer look at this workplace culture and its impact on Janine. So in Janine's case, which of the CSA psychological factors are not being met in this scenario? And what would be a typical response to this kind of work environment? This work culture makes Janine feel as though she cannot accomplish the work challenges put before her. When compared to the factors identified in the CSA standard, there seem to be some psychological deficits in this organization. So we have identified at least 6 of the 13. For example, take a look at workload issues. So Janine feels overwhelmed by her physical workload and does not feel that she can say anything about it. The plant is understaffed, so workload never eases up. Lack of recognition. Janine feels that she's not valued. In fact, she's undervalued in that she's a woman. Lack of involvement and influence is another CSA factor. Janine has ideas to make improvements, but does not have the confidence or the opportunity to bring those ideas further. Engagement. Janine does not feel connected to her coworkers, her manager, or her workplace. She just puts in her time and then escapes home. Respect and civility. Janine does not feel acknowledged by her boss, nor respected as a worker. He does not communicate well with any of his workers, and for sure, the supervisor certainly sets the tone. She feels like a cog in a wheel and no more than that. Clear leadership, as Jen mentioned, Janine does not feel comfortable to ask questions for one, and does not have a sense of how her work fits into the bigger operation of the company. Every thought we have as humans creates a hormonal response in the body. In the workplace, each interaction will cause a physiological response, a psychological response, and which in turn will affect a behavioral response. So all of these things are kind of resulting out of that culture. These responses can become positive or negative depending on the work culture of that organization. And that's the key. The workplace culture will determine the impact of those factors on its workers, whether they put positive or negative. And these responses are measurable and observable. So what do you think will be Janine's responses to be in this work culture? First of all, what are the physical or physiological impacts? So honestly, with that level of stress, she's going to be in a state of fight or flight. She may experience an increase in blood pressure. That increase in blood pressure can place added fluid pressure onto her muscles, ligaments, tendons, and joints, which also can reduce her range of motion. So we have a direct physical, physiological response to the psychological stressors. She can experience an increase in muscle tightness and tension, which will also reduce her range of motion while working and can reduce her level of strength. In the fight or flight mode, her body will release stress hormones such as adrenaline and cortisol, which can reduce her awareness of pain at the moment, and over time can have a negative impact on her entire body systems. This heightened level of sensitivity and urgency may cause her to lift more, push more, and work more quickly, which could place her at added risk. This brings us to the behavioral responses. So on the behavioral side, we know that accidents and injuries are more prone to occur when people are not focused in the moment, or when they're distracted. When we are worried about things that happened at home, a harsh conversation at work, or are stressed about meeting deadlines, we're not in the moment. And for an example, even the supervisor not acknowledging when he comes in to work, that can be a stressor. We are less likely to see obstacles or hazards, and so we are more prone to injury. Janine feels rushed to meet deadlines and so works through her breaks and likely cuts corners to get things done. This can lead to overloading and impact tissue recovery. That is the rest period that your muscles require to recover from work. She may become frustrated when things do not work out, like when equipment gets jammed or doesn't function properly. So she might exert extra effort to make things happen, again, elevating the level of risk. She may also self-medicate to overcome the discomfort related to overexertion, thereby impairing her abilities. So let's compare this to a more ideal work culture, a stronger work culture, as Mike was describing, and look at its impact on Janine. So Janine works in a warehouse where stock items come in and out daily and need to be moved in and managed in a timely fashion. The work is heavy and can be relentless depending on the deliveries that day, but there is always help and equipment around to do the job. Janine's manager is a bit gruff, but always makes a point of greeting everyone as he comes in the morning and makes eye contact as he passes workers on the floor. He often stops for a quick chat and makes a point of getting to know everyone. When he gives out assignments once a week, he begins the shift with a tool talk, and every day he leads a quick pre-work stretch session to get everyone moving. He discusses what the day ahead might look like so workers know what to expect. He provides tips on how to do the job safely, and Janine feels that her safety is important to the company. Janine is tired by the end of the day, but energized. She feels committed to her job and the company, and although there are days when she feels the pressure to get her orders completed in time, those days are few and far between. People want to work for this company, and so they are rarely short-staffed. The workers are encouraged to take their breaks. Janine has made several friends at work and looks forward to seeing them every day. In fact, Janine loves her job and looks forward to coming in every morning. She has learned from Toolbox Talks the importance of exercise on her job, so she now goes to the gym 3 times a week after work. Janine has noticed some ways that a few small changes to the work layout could be cost-saving for the company. So she brought this idea up to her manager, who took it up to his manager, and within a week, the changes were made and the job became that much more efficient. The company is experiencing less turnover and better retention, but also improvements in productivity. So how does this compare to the first scenario? Same job, same person, but the more positive culture will create an environment of support and collaboration with a more restorative nervous response, which is healthier in the long run. So which would be the typical response to this work culture? Janine is now working in an environment where she feels that her challenges are surmountable and achievable, and those are important qualities. She now feels that she's adequately equipped to meet her work challenges, results in an increased belief in her own abilities to succeed, a better sense of engagement, a little more determination in her efforts and ability to focus, and a generally more interest in the job at hand. So when we relate those back to the psychosocial factors that we mentioned earlier, let's see how they measure up in a more positive, strong culture. Workload issues. Janine feels safe to ask for help, and because people want to work there now, they are rarely short-staffed. Recognition and reward. Janine feels that she's a valued contributor to the organization. Improvement involvement and influence, Janine has ideas to make improvements, and some have been implemented and have saved the company a lot of money. Engagement. Janine has friends at work and feels committed to supporting her company's goals. Civility and respect. Janine feels acknowledged by her boss and he communicates well to the team. Clear leadership. Her manager now talks to the team and lets them in on what is happening each day. He also shows leadership by participating in the pre-work stretches. What is more likely to happen now is that Janine will be working in a stronger safety culture where workers feel that there's time to follow safe procedures because she has the confidence that her leadership is truly concerned with her safety and will allow her the time to get proper equipment to do her job so that she can tag out broken equipment without the fear of retribution or criticism, and that she can focus on proper body mechanics, and that she can take micro breaks when tired for tissue recovery. She works in a culture where safety is talked about and peers will coach one another and provide assistance as required. The employer invests in safety and also supports social connection, which is also important for the sustainability of that culture. The goal as employers to develop and sustain a strong culture is to create a workplace where the first choice is the easiest and safest choice. So physiological, what are her responses to this positive culture? Her muscles can now relax and therefore work to their potential. Her blood pressure normalizes and therefore reduces some of the pressure off the joints and soft tissues. The stress hormones, adrenaline and cortisol, return to normal levels, which calms the system. Her level of sensitivity and vigilance lowers that she can now focus on better work and recognize hazards. Her body, although still working, can move into a more restorative phase where healing and recovery can take place. And how does this positive work culture affect her work performance? Janine can now work with increased focus on her task and her environment, so she's less likely to overload her body and she's more likely to see hazards before running into them. She's less likely to be distracted, so can keep herself safer from hazards. She now feels less rushed and able to perform her tasks in an efficient but not frenzied pace. She feels comfortable taking breaks, so her tissues have the opportunity to recover and rest. And she's not so easily frustrated, so will approach problem solving in a controlled and safer manner. The benefits from working in a strong and positive culture can affect everyone in the workplace, including workers, supervisors, human resources, the safety folks, productivity and quality departments, and the stakeholders. We are all involved and we're all affected, and Mike will now describe how.
Okay, so thanks, Gail. Okay, so now we're going to move back into culture and kind of tie this all together. If you just want to mute yourself, Gail. So Gail talked about in the case study how a positive or strong safety culture benefits the individual. And I'm going to open this up to the chat. How do you think a strong safety culture benefits an organization? What does it do for the organization? And you can think, how does a negative culture impact the organization? Yeah, so productivity increases, and that is huge, right? Increases production and profits, leads to less accidents and incidents. Like I said, throughout this presentation, you can have the best safety and health program, but if you don't have a strong culture, your workers aren't going to be invested and they're not going to follow the training or the safe work procedures that you provide. Leads to retention, right? You become the employer of choice. So yeah, word gets out. If you are a safe organization and you have a strong culture, people are going to come work for you, which is directly tied to profits and your bottom line. Yeah, improved morale, commitment. So having a strong culture has huge impacts on an organization. So great job. Next slide there. So yeah, and everybody mentioned this already. So increases the loyalty of workers, increases that job satisfaction and improved worker well-being. When workers are more satisfied, they're more productive, as people mentioned. It reduces injuries. So it can decrease your WCB premiums, and it allows you to retain the top talent that you want to retain and attract that top talent to your business. And it's directly tied to your bottom line. So that's really important. So safety culture and systems, so meaning safety and health program, or in this case, when we're talking about psychological health and safety management systems and MSI prevention, they go hand in hand. You can change the workplace culture around psychological health and safety and MSI prevention. And you have to do that in order for these programs to succeed. And that's really the key takeaway here. And increased production and satisfied employees, definitely. So this is the BP oil spill, or the Deepwater Horizon oil rig. And as we saw in Gail's case study at the beginning, we saw that was demonstrating a poor culture. And having a poor culture definitely leads to increased incidents, and it could lead to a catastrophic incident. And that's what happened here with the BP oil spill. So basically what they were trying to do was they were connecting to a ocean floor well. And when you connect to a well, you'll have gas release, including crude oil, which will come up what's called a marine riser. So it's a long tube that extends from the platform to the ocean floor. And they have to counteract the pressure that's created when methane gas, for instance, enters that tube. And how they do that is they use a liquid, they call it mud, but it's a solvent. And they inject it into the tube to counteract that pressure. And what ended up happening here in this case is they lost the ability to counteract that pressure. And that methane gas just pushed that liquid out of the tube onto the platform. And then eventually methane gas escaped onto that platform. And it just took one mechanical spark to ignite that. And it resulted in the explosion and eventual sinking of this oil rig. What's really interesting about this is, because this incident happened in the evening, is the day of the incident, BP executives attended the rig and they were given safety awards for 7 years of no time loss incidents. They were also provided, even after this disaster, bonuses of $100,000 because they met their productivity targets. So thinking back to those dimensions that we talked about, do you think BP valued their workers equally with productivity and pay? If I open that up to the chat. So based on that information that I told you, do you think this was a positive or negative culture? Yeah, so they valued productivity more than safety. So definitely a negative culture. And when they did their investigation, they found that trade-offs were made to favor productivity. They didn't value safety and health. If they would have done the appropriate risk assessments, they would have been able to catch different hazards and be able to control those hazards. But they valued production. And unfortunately, it resulted in a severe catastrophic incident from a safety and health perspective, but also from an environmental perspective as well. So having a negative culture will increase your injuries, even though you have a good safety and health program. Next slide. So to tie this all together, what can you do today in your workplace to build towards a safer, stronger, and more positive work culture? You really want to ensure your leaders are committed to safety and health, including any psychological and safety management systems you have, or MSI prevention programs. This is done through their actions, right? If you have workers reporting hazards and the employer's not doing anything about it, it's just going to send the wrong message, and that's a negative culture, and then they're just not going to report. So leadership needs to take that action. They need to allocate the resources for safety and health, and they need to communicate those decisions and indicate that they prioritize the safety and health of workers over productivity. Also, be kind and supportive, and be aware of your language, right? Words are powerful. You want to encourage open communication between workers and managers. Because again, if a worker identifies a hazard, if that trust and respect doesn't permeate the workplace between a worker and manager, a worker is not going to report, and it could lead to an incident. You want to create an inclusive work environment, so all workers matter and their input matters. No one wants to feel that they're excluded or left out. We spend more time at work with our coworkers than we do our own family. So it's really important in your workplace that everybody's supportive, they're patient with each other, they're accepting of one another, and that just helps feed that strong culture. And in turn, as everybody said, it motivates employees, it increases that job satisfaction, which increases productivity. You also want to incorporate psychological health and musculoskeletal prevention into how you do business. So you want to adhere to your manual materials or your patient handling guidelines, and you want to apply what you've learned in training and take the time to use the equipment that's been provided to you, right? Again, if you have that negative culture, any training that you throw at a worker, they're not going to, most likely they're not going to follow the training or those safe work procedures. So you really want to have that strong culture. So as we've seen throughout this presentation, you can see that safety culture is part of organizational culture and corporate culture. They all feed off one another. And basically all of them reflect the personality of the workplace. If you have a poor corporate culture, you're not going to have a strong safety culture or an organizational culture. So they all work off each other, and you want to move towards that strong culture. It influences how workplace safety, including MSI prevention and psychological health and safety, is prioritized at your workplace, as well as the decisions and actions taken surrounding it. It serves as the rudder of an organization, so it's steering it through both normal and turbulent events. And in our current economic situation, we're definitely entering some turbulent events, and having a strong safety culture will help you steer through that change management. So it's really important. Though complex, and though it takes a long time to establish a strong safety culture, it doesn't mean you shouldn't focus on it, because we've talked about the benefits of a strong safety culture. It reduces injuries, your workers become invested in safety and health, and it increases productivity. So the next slide here is just the resources we have at Safe Work Manitoba regarding safety culture if you're interested, and MSI and psychological health and safety. We do have a safety culture assessment tool. It basically tests the 6 dimensions that we talked about. So does trust and respect permeate your workplace? Is your leadership committed to safety and health? Is everybody accountable when it comes to safety and health? So it tests each one of those through 12 questions, and you can survey your organization, and then it provides an overall score from 0 to 4. So 0 being indifferent, where that's an organization that really doesn't have a safety and health program, doesn't have a strong culture, and they've just been lucky. So workplace safety and health just hasn't shown up, where they haven't had an incident. And then you have on the other opposite end, the 4, which is generative or proactive. And this is basically safety is how you do business at your organization. So if you do it once, it establishes a benchmark of your organization. And if you do it on an annual basis, you can actually track how your safety culture is progressing over time. And then we also have the safety culture toolkit, which has additional resources on our website. We also have a musculoskeletal injury toolkit that you can access. It has a ton of information on MSIs. And then we also have the psychological health and safety in the workplace toolkit, which has all our resources on PHS in one location. So with that, that closes this session. So I will pass it on to Tiffany, and we'll take any questions. So thank you, everybody.
Whoops. Well, before we get into the questions, let me just officially say thank you, everyone, for putting in a great presentation to all 4 of you. Lots of little tidbits running around my mind, but just to keep it kind of short and sweet. We said this in our webinars a year and 2 ago, that where we are with the psychosocial factors is almost like where the physical ones were in the 1980s. So we knew at a certain point that bending over, touching your toes, lifting a weight, some amount of twisting, some amount of bending your wrists and squeezing led to higher reports of injuries. And then the question was, well, how much and how often? and we're still better. Now, I will say 20 years later, we have many ergonomic checklists that are valid that people can learn. You don't necessarily have to be an expert on it, but or go to 4 years of university to learn how to use these tools, but they're decently good at giving you a sense of what's too much, and there's numbers that go with it. So wherever your line in the sand is, if you're above it, you have a problem, do things to make it better. So again, you know, as time goes on, that's where I feel we're at. So in a way, a nice little segue into tomorrow's presentation with Jeffrey and I, where we will be presenting two ergonomic checklists that have both the physical side and a little wee bit on the psychosocial side. Actually, one is very psychosocial with physical, and the other one is more physical, but in the process of doing it, you kind of get into the psychosocial part too. All right, so that's about all I wanted to say. And then, of course, thank you everyone for the presentation. It was great. So now I'll turn it over to some questions. And if there's anything that the four of you that say, oh, I really wanted to say this, the floor is yours. We have it for now a little while. All right, so I'll turn it over to Tiffany to see what questions came through.
Okay, so for the first question, so any suggestions for engaging leadership with other demands in their roles? If you're relating that to safety culture, one of the best ways to do that is really present them with a business case on why or how a strong culture is related to productivity, and is the best way to probably engage leadership from a safety culture perspective.
Yeah, and I think it's even just opening up conversations and having discussions, and really just kind of building on, you know, the business case. It's nice to show the monetary part, but it's also showing that this is the morale, the productivity, the, you know, the being at work and being, you know, productive. So it's really showing kind of that whole encompassing around building your business case and building that engagement with our leadership.
Yeah, and using like key performance indicators such as time loss, injuries, days lost, and tying that all, and absenteeism you can look at as well. So if you have a negative safety culture, most likely you're going to correlate well with absenteeism and potentially time loss injuries. So looking at those key performance indicators would be a good way to engage leadership as well.
And to piggyback on Mike's comment, when it comes to things like time loss or days lost and those kind of costs, those are what are seen in occupational health and safety as lagging indicators. So if you really want to kind of change and pivot how your organization is going to switch their culture, they have to start identifying what's called leading indicators. So things like, are safety inspections being done? Are hazards being reported? And kind of anything you can do to sort of prevent an injury from happening in the first place, those sort of leading indicators can actually help to create that shift in workplace culture as well.
Sorry, I can't see the Google Doc because I'm sharing my screen. So if there's another one.
So the next question we have is, we have an issue where certain managers do not effectively deal with bullying in the warehouse. How can we improve this concern? Anybody want to take that one?
I think one of the biggest things you can do with any sort of concerns around bullying or harassment or violence is really making sure you have a really concrete policy that your whole organization follows and knows that exists. Because sometimes, you know, these things might be developed, but nobody really knows what they are, and have really some really, you know, good training around what that means, where people can understand, you know, the impacts of their words and their behaviors and how that impacts the workplace as a whole. So really following your policies that have been developed. There's also a lot of training that can be taken, organizational training or individual training, where you can look at helping your entire workforce understand what that looks like. Well, if anybody has anything to add.
Yeah, so just having that, I agree, just having that harassment policy, ensuring your workers and management are trained on that policy. Don't just create a policy where it just sits on the shelf collecting dust. just ensure there's that training, and maybe even doing that on an annual basis will help with that. So the next question we have is, do you have any tools for calculating costs of incidents that you suggest, as you said, showing economical return to managers, return on investment?
So I
go ahead.
just responded to that I've seen different metrics collected by different organizations to measure the impact of safe culture. So there's like no one set tool, but sometimes a return on investment is kind of a good starting place because it's fairly easily measurable. The Ergo Plus website has a synopsis of studies. The Washington study where 250, Andrew, workplaces were studied on the return on investment for making a business case about investing in this kind of stuff. So it's either the Washington study, if you look that up, or check Ergo Plus, and they've got a whole whack of resources on that too.
There's also a really good one related to psychological health and safety, the Deloitte article. They actually surveyed or kind of followed 10 Canadian companies, and 7 of them reported their information, and they actually provide a template, but also just some information within the document to show that I think for one company, it was like $4.10 for every dollar spent that they had a return on investment. So some really good information that's in there when you look at implementing some psychological health and safety and ergonomics into your culture and how that all builds together. And yeah, Jeffrey, you had mentioned the mental health workplace strategies for mental health. They have fantastic resources on their website. They're all free, and you can use them to share information about. They have any topic that you want to look at. They have usually. So, yeah.
Okay, so I think that's all the questions. Andrew, do we wrap this up, or I'm not sure who to pass it on to?
Yeah, I just wanted to say, we can keep going and going and going, right? So thanks for all the extra comments and resources that were posted. Yes, as Gail has said, that traditionally there's been a lot of little online calculators and ways to look at the injury cost calculator in that sense, from having had an accident and the costs that go into it, the investigation, and then preventing it. There's the angle from the ergonomics productivity perspective in terms of improving, let's say instead of grabbing something heavy from your ankles and lifting it up, which at first you think hard on the back, you also look at it from the perspective of time and motion. So it takes time and energy for a human being to go down and pick up. So there's that sort of engineering look at it, cost calculator. But then there's, as Gail said, they're looking at it from a safety culture. And I remember long time ago, kind of studying where absenteeism, there's a component for health and safety in absenteeism. So basically it was, hey, talk to your HR professionals that are hired. They would have learned in school the percentage of absenteeism that is due to poor safety program and poor safety culture. So you can kind of take that general, I have no idea what it is, 5% to 30% of absenteeism, short-term lost days, and all the costs that go into it in terms of someone's off work, so now we need to get somebody else. So whether it's overtime or whether it's a new hire cost, or just overloading people and off you go, maybe production actually suffers in that way. So there's that angle that I've seen at HR. So your cost of turnover, your cost of retraining and overtime. So it's all different places. Now, usually a health and safety committee member doesn't really have the specific technical information to put into a really good, robust calculation. So just generally speaking, Now, I know the Institute of Work and Health worked with WCB in Manitoba years ago to put what's called an incident cost calculator, but I don't think it's on there anymore because, you know, the way premiums are calculated changes. So that no longer was valid. But I know if you're part of the IBSPs, Industry-Based Safety Associations, you have, what's it called? Compass? Is that what it's called? You have access to that where you get your injury data, and then you can kind of put in if we were to make these improvements and save 5%, what does that end up being? And that's a very conservative 5%. If you really put in the elements of a safety program and a safety culture, maybe it's up to 25, 30% of your premiums over a short period of time. So there's different ways of doing that. Okay. So yeah, I mean, like I said, you keep on going, but at that point, I haven't looked at the chat. Is there anything else that came in the last minute or two? Very informative. Thank you. I'm part of HR, so everything will be great. Aha. And off we go. Okay, everyone. So as we said earlier, we'll have this posted in the next little while. So if you hear something you wanted to review and take notes, that's the best learning, right? Listen to it, next stop and make notes, and then think about it, and then do something, create an action plan for your workplace. So I know that we here at the Occupational Health Center have some resources to help you. And of course, Safe Work Manitoba has such a great crew just waiting to go out and help you with all your safety needs, whatever it is. You know, they're not going to come out and do it for you, but they'll mentor and help you in a preventative way, right, everyone? So there you go. Okay, so thank you, ELS.
I don't know.
What's ELS stand for? English second language? No. Environmental. I don't know what that one means. Engineering labor standards. Okay, yes, thank you. So, don't get me going on that one. Engineering labor standards are for time, not for safety. People get that mixed up. They think if something is correctly done for engineering labor standards, that it's safe. That's not what it's used for. It has it says it's for comfort and efficiency, and people assume it's for safety, but there's been many studies done where the engineering labor standards was correct, but not safe. So really we need to, this is a bigger issue, but that's what we really need to push and educate people to understand, that just because it's within doesn't mean it is safe. Okay.
So Andrew, does that actually mean like it's the engineered labor standard is for like a 5'10" man, and then it turns out a bunch of 5'4" women have started coming to work at the place, and then the issue is it's at an ELS, but not for that kind of type of body?
It can be. It can be, but usually they say take the people that you have, or take the trained one worker, or they take these population studies and go from there. What I'm talking about is, let's say you have a pallet and you have to step through and twist and reach down. The engineering labor standard gives you a grace time component. So it gives you a little extra time to do it. Doesn't mean that bending and twisting, but you have more time to do it. That doesn't make sense, right? You don't want a heavy load while the body's twisted, grabbing from your ankles whatsoever. All right. So, and I've talked to people that are called experts. These are the ones that the companies hire for big money to come in and help them. And they kind of have this assumption that the ergonomics is good to begin with. So if your ergonomics is good to begin with, then the engineering labor standards work. But when does that really happen? All right. So you got to make sure the ergonomic principles are there, the good practices are there, and then put in your engineering labor standards. And that's what's being missed. So if anyone's really interested and want to get me going some more and talk to me, give us a call at the Occupational Health Center. I'd love to kind of help you out that way.
And that's what David's problem here is talking about, right? They've got the labor standards met, but the ergonomics are not there.
Right to my point. And in a way, people will argue but the numbers are correct. But the numbers are correct. And I'm like, yes, the numbers are correct for motion, not for safety. Okay, there you go. If you're a robot, correct. If you're a robot. Yeah. Okay. So David, give me a call and love to talk more and help you out. All right. So there we go. About 10 after. Off we go. So thank you everyone for joining us. And again, one more time, thank you for safe work. Did you enjoy putting this presentation together? Of course. Okay, thank you, team.
Thank you.
Thank you, everyone here, and thank you,
Thanks for having
Tiffany.
us. See
Yeah,
you.
and thank you,
Thanks,
Tiffany,
everyone.
for getting this whole Zoom thing going. And hey, let's do this in person next year.
And thank you again for having us, Tiffany and Andrew.
All right, thank you, everyone.
Bye.
All right,
Bye.
goodbye.
Bye, everyone.